screen. All right, welcome everybody to another Health Hustle Chronicles Fireside Chat. Today we're blessed and we're joined by the one and only Heron Mitchell, Chief Operations Officer for Foremost Family Health Centers. And so it's going to be, I would say, I guess the word that I'm looking for, impactful. It's going to be eye-opening. There's going to be a lot of knowledge that's going to be shared, stuff that we can glean from that's going to help each and everyone on the call help us reach that next level of our career. So without further ado, let me get to the next slide. Let me see if my slide works, see if I figured this thing out. All right, so let's kick this things off with introductions. Welcome again, Fireside Chat. Today's chat is about stepping into leadership, healthcare, and career growth. It's presented by myself and as well as Heron Mitchell, COO, Foremost Health Centers. And before I turn it over to Heron, let me just kind of introduce you to who I am and the impact that I'm trying to make. I'm Patrick Hart. I spent 15 years in healthcare, kind of rose through that ranks, reached that VP level. Partnered with the technology company where I ran a business unit, and I supported 8,000 clients across the U.S. And then, as a business unit leader, I had probably somewhat close to 50 employees underneath my leadership and guidance, to include sales, marketing, product management, scrum masters, and a development team in Chennai, India. We were basically positioning ourselves to gobble up market share and to sell the company, and we were able to do that successfully at the end of 2018. Since then, what inspired me is being able to reach back, connect with other people, and help them through their journey through elevation in careers. Because I feel like a lot of people that get into healthcare, we get into it because intrinsically we care about providing from others in some type of way, whether that's bedside or pharmacy or behind the clinics doing tech or product management, whatever it is. But I think there's tons of opportunity. What reality is, we often get stuck going up that career ladder in these certain positions, and we don't know how to get past them. And from a healthcare standpoint, we don't do a great job helping people with career laddering. So I wanted to kind of be that voice of reason, somewhat of an influencer specifically for healthcare, introduce you to game-changing people like Heron Mitchell, as well as some of the other people that are on the call, and just have you learn from them and their different and better story. So a little bit about me. My company is PDP Media. And that's P as in Patrick, D as in dog, P as in Patrick Media. You can connect with me there, or you can see the streaming banner at the bottom that says That Healthcare Guy. Across all social channels, you just type in That Healthcare Guy. You can pull me up there and follow some of my content as well and the impact that I'm trying to make. So with that being said, Heron Mitchell, please, please, please introduce yourself to the world, man. We're excited to get to know who you are.
Thanks, Patrick. I appreciate that introduction. It's like I'm coming out to Steve Harvey or something. I feel like I'm but what I've been in healthcare for about 20 plus years, and I got in the non-traditional way, I guess. Prior to me being in healthcare, I was making cars and trucks at General Motors, and that happened to be the reason that I was actually recruited into my first job in healthcare as kind of a Six Sigma black belt, because at the time they were looking for people that had a solid lean background. Of course, lean being the Toyota manufacturing system, although General Motors would never call it that. They call it the global manufacturing system, but it's the exact same concept. Just making sure that we're eliminating waste from the process to make it more efficient. And really, without getting too deep in lean, because I love lean, because of the culture behind it and the fact that it brings in complex teams, and basically you give them the tools and they come up with their own solutions. It's a management tool. That is why I got my first job as a project manager, black belt at Heartland Health. And I actually was embedded with the ambulatory services team, bringing in the patient-centered medical home during when everybody was kicking off the Affordable Care Act, and bringing in the new concept of, instead of incentivizing healthcare systems for fee-for-service, we're incentivizing them for outcomes. And, it's been years now, but we're at a place right now where it's still kind of not all the way there, but it's getting there and it's coming. And, I think CMS actually by 2030, they want to move to the 100% type of value-based model. where we are looking at patient outcomes over just having episodic care. So that, being embedded with ambulatory, always putting a seed in my head that I want to be there and at the population health level doing preventative medicine, because really that's where it's at. If we can prevent people from going to the hospital, we can bring down the cost of healthcare. We can increase quality of life. And so I started there and kind of moved to Texas, became a Texan, and director of operational excellence. And but the thing about being a project manager is that you're really not in charge of anything. You're kind of an internal consultant, and I have to be in charge. So
right.
I prefer to do that, and that's because I went through the crucible of being in General Motors, where you have a small complex team, and that's your team, and that's your part of the line, and everybody in the plant is depending on you to get those vehicles through there. So that really is something that I like to do. It inspires me to move people and teams like that. And so I went to Parkland as the regional director for the East and then the Southern region of community-oriented primary care centers. And then I actually got the blessing of working with Joyce Tapley at Foremost Family Health Centers, which is kind of an extension of what I was doing at Parkland, but even further down into a place where there's a lot of social determinants of health needs that are not being taken care of. You have homelessness, you have unemployment, you have food insecurity, you have internet insecurity, you have people with transportation issues. They're living at or just slightly above the poverty level. So those types of things draw me. Some people are drawn to certain things. Fire persons are drawn to fires. Some people like to be crime fighters and they become policemen. I like to get into a community and make it better. And if you're taking a look at Dallas County and you're taking a look at the health needs assessment, area codes like 75215 are where you have a lot of high mortality. If you're talking about the life expectancy of people that live just a block south of a highway, I think it's like 30, you live 20 years less.
Wow.
Just because you're down, you can see where people are living longer, 20 years longer. That's a lifetime. Right. And so being the type of people that we are, we cannot just sit on the sidelines and let those things happen without trying to at least take the skills that we have and bring those to bear on the community. And so that's where I am right now. I kind of brushed all through that, but all through that, I've been married to my wife for about 25 years. We got 3 beautiful grown children right now. I have one more that's about to leave the nest. He's going to be an engineer. I have a daughter in law school. I have a daughter in marketing. So along the lines, I had a family life. And, we just moved around with General Motors, and my wife is a very successful executive at PepsiCo. And she actually compliments me in terms of the discussions that we have about business strategy. And so that, in a nutshell, that's me from a public and a private perspective.
Power couple. Love it.
I love it too. I was going to say the same thing. This is Michelle Obama and Barack. This is awesome. Listen, there's a lot to go off in your background because there's so many different things that you said that I just kind of want to pick up and expand and elaborate on, just for clarification for the audience.
Sure.
One of the things you mentioned is black belt.
Yeah.
Now, not everybody that's going to listen to this podcast understands what a black belt is or is even interested in becoming a black belt. So please shed light on what exactly is a black belt and how does that apply to, I guess, what you're doing today.
Mm-hmm. So I mentioned lean was out of automotive manufacturing. Actually, is the Toyota concept. Six Sigma is actually a Motorola concept, and so they have different levels: green belt, black belt. Now it's yellow belt, white belts. And when you say to the people, they're ready for you to like chop a brick or something.
Right, jiu-jitsu or something, Chinese, whatever.
The Six Sigma is related to actually a bell curve. So if you think about Six Sigma, it is actually the sigma it stands for standard deviation. And so if you think about a bell curve, the mean is in the middle And as you move along the bell curve and it gets close to the x-axis, you go through different standard deviations. Well, the Six Sigma represents 3.4 problems per million opportunities, which is almost negligible. Now, it's not zero, but it's a way to reduce variation in the process. It's a systematic way based on statistical analysis, very deep statistical analysis, to get you to reduce the variation of whatever it is, that whatever widget that you have going through the process or whatever process that you have. And it can be used anywhere. It's used a lot in manufacturing because there's very tight tolerances on certain things, but it can be used in healthcare. So that in a nutshell is what it is. Now, in my opinion, healthcare needs more lean and Six Sigma. It isn't that they don't need Six Sigma, but you need to be able to lean out a process, which means reduce the waste in it before you lock the variance down. Because if you apply Six Sigma to a process with a lot of waste, basically you're reducing the variance in a process that is wasteful. There's a lot of waste in healthcare. That's why we have waiting rooms. That's the very first thing you're going to do is wait. So that's a waste. Nobody's paying to come to the doctor to sit and wait. They're paying to come to see and get this care that they need. But this is another methodology that you can use to reduce variance. Now, when we talk about variance in healthcare, as Dr. Trinette knows, based on her background, the variance in healthcare can be infection. It can be things that happen to you when you go into the hospital. Nosocomial infections, things that harm, and harm does happen in the healthcare environment due to error. And so if as a person in healthcare, if I'm looking at 3.4 million opportunities, 3.4 million opportunities to fail per million patients is amazing. You're getting to airline numbers. Unfortunately, we recently had a very bad crash, but before that, I think the numbers were in the millions. Like it was an astronomical amount of airline travel that happened before that, between catastrophic events. And so you're trying to get to that in other industries. And so this is just a way to use that methodology to apply to your standard healthcare processes to remove the variance.
Thank you for that background as well as the insight. So today's, Fireside Chat is about stepping into leadership, healthcare, and career growth, right? And so the first topic is making the leap, transitioning from manager to executive leadership. So my question to you, Heron, is what's the key difference between like a mid-level manager and the executive leader within a healthcare system?
Okay, I can tell you acutely what it is.
Okay.
And Mark can probably tell you a little bit too, because Mark has actually been a CFO at a couple of, like, several organizations in up in the C-suite. But this is my first foray into senior leadership. So okay. I've always been, before I went to senior leadership, of course, I was a director, and now I'm a chief operation officer. And I can tell you specifically, the transition between being a director to a COO, the difference is it is a part of my DNA now, the welfare of just about, if not all, the employees in that organization.
Okay.
I am extremely sensitive to how they're doing, the prosperity of the company, being able to make sure that it's open so that they're gainfully employed, making sure that we are expanding so that the name of Foremost can get bigger and bigger so it can serve more and more people in the community, making sure that we have standard processes in place, making sure that the revenue cycle is efficient. So as the physicians are finishing up what they're doing, we can get claims in and get adjudicated very quickly and very low cost. Those types of things. I would say that there's a certain stress level at the director level or even at the manager level, right. But the stress level for me now it's like it's made those things really a part of my life and a part of my soul. So I'm extremely sensitive to things that happen within the organization, positive and negative. And it's really a kind of a call to action, or it hits you in your heart being at this level because you have so much responsibility and people are looking towards you. Just the way that you act, even indirectly, body language, sets the culture. You know, at other levels, you may act a certain way, and they'll be like, okay, you know, that's normal. But if you're the chief of something, CEO, COO, people are really looking at you and saying, okay, so we want to believe in you. We want to trust in what you're doing so that our families are safe. And so as a chief officer, I really have taken that, and it's become ingrained in my daily. I'm pretty much on 24/7 at this point. You know, even when I'm on vacation, at least for the first couple of days, I'm thinking about, what are they doing at Foremost?
Right.
What can I do to help the people at Foremost come to work and say, this is the best place that ever worked, and I want to stay here. I want to bring my children here. I want it to be generational. So I think that was the biggest transition. Of course, you get into the changes from between tacticals and strategic functions that I do. I think more strategically now. What are we going to? How are we going to look 5 years from now? How are we going to look 10 years from now? How are we going to get there? But I feel like I've set a team of people behind me that even if I say that we want to be, you know, down in South Dallas and DeSoto and Lancaster in 5 years, I can give that to my team and they can come up with tactical ideas to make that happen. And that's also important. Being this level, making sure that we have a good team working with you is very important.
That's really, man, that's really insightful. I mean, you also mentioned too, Mark, I see you on the call nodding your head. You mentioned that Mark's a former CFO. Is there any additional insight you can add to that?
Well, what I was thinking when Heron was talking is, as you move through different levels of responsibility, authority, and accountability, what's happening is the scale and scope of the people, processes, and things under your control grow. And also your point, Heron, your perspective about the things you have to control grow wider in terms of depth and breadth and time frames. So you have to think what's going to happen next, not just what's happening that you have to turn in the next day or two.
That's right.
And so I was thinking about that as you were talking. I was hoping I could get it out somewhat eloquently.
You got it.
Hopefully you're recording this because I want to transcribe it.
It's definitely been recorded. And, you know, both of you guys led to, which was the follow-up question. It sounds like you both touched on it, is one of the biggest mindset shifts that needs to happen as you make that transition from director to like the executive level role is the buy-in, not only within yourself, but buying into the organization, the culture, and then understanding it's no longer about yourself. It's about the greater good of the organization. Is that correct?
I would think so. Yeah.
And I was thinking, Patrick, I mean, that phenomenon where you're kind of stepping up begins, you know, when you're a new an employee and all of a sudden you're a supervisor and you have to get things done with other people, not just doing it all yourself. Yes. That happens at every step of increase.
Yes.
You know?
So, and you know, I got a funny story around that. When I first started General Motors, not as a supervisor, not the very first job I had, but the second job I had, I was in production, and that is a very, very stressful job because you're tied to the line. Any minute that you're down costs the company like $40,000, and so there's a very high stress environment. So being a young supervisor, I did exactly like Mark said, don't do. I would try to go and make repairs on the line, and I'd be running around and, you know, doing it's everywhere. I wouldn't utilize my team leaders. I was just trying to be in everything. So came time for me to go to another area. And so I'm like, you know, the guy that came in after me, he was a seasoned supervisor. He had been there for 30 years. And I'm kind of walking him around the area. And I'm running around all night. I'm tired at the end of the night, barely able to. Sometimes I would take a nap before I went home because I was so tired.
Oh, wow.
So he's like looking at me like, what are you doing? Like, what? Why are you doing this? And I'm like, this is what you got to do. This is the hardest area. You have to be on top of it. And he's like, okay, thanks. So I go to my other area and a couple months and I come back and I come to the area just to visit and check on him. And I look around, I'm like, where is he at? I asked one of the team leaders, where is he at? He's like, oh, he's in his office. He never comes out. and the line was running better. Like it was running way better. He had engaged the people. Like the team leaders were doing what they're supposed to do. The people were like doing in service repairs. I went in there. He's in the office, like doing some paperwork. I was like, "How you doing?" I mean, at a meeting, I said, "I'm coming here to drink from your fountain of knowledge. Tell me how you doing." He said, "You have to get people. You have to empower them to do their job." Another thing that I heard, I was at, I just got back from Congress for American College of Hospital Executives, and I was listening to a lecture on revenue cycle. And he was talking about having one person like be, have all the knowledge and not share it. And
Right.
he's like, the metaphor that he had was, let's say that everybody knows Tom Brady is the GOAT.
Right.
Is the GOAT. And you know, you can argue, but really there's not much.
Whether you like him or not, hands down, his numbers speak for itself.
He said, okay, so if you could take Tom Brady and clone him 11 times and then take that football team and put on the field, that'd be the worst football team ever in life, because you can't do that. Everybody has to have different skills and play their position. You can't have, just because you think that this person can do all the positions, that will not work. And so I thought that was another great way to look at it. You have different people with different acumen. They have different skill levels, but that's what makes a complex team dynamic. That's what, it's not just having everybody groupthink. It's having diversity of thought and in different skill sets at different levels. So where I have a Mark Erath, I have a Dr. Pierre, and I have a Patrick Hartnett. We're all different, and together we form this juggernaut. And that's where you get the innovative and the disruptive, improvements in all this in technology and healthcare, by having diversity of thought and that everybody plays their position and we trust each other to do that. Building that trust is not just something that happens organically either. You have to be intentional about it. So when you put the effort into that, which is what I do with a lot of my teams, they really take the ball and run. They produce stuff that you wouldn't even think about.
Right.
So I'm very happy to do that with my teams.
I mean, the big word that you said, I'm just going to put it in caps, is empower, right? It's about empowering the team, embracing everyone's uniqueness and their gifts that they bring to the table. But also as a leader, what I picked up on is giving back as much knowledge and insight as that you already have. That way you're not the only person that has that insight. Is that what I'm picking up on?
That's right.
And I got a follow-up question, because a lot of people here, and they would love to be in that chief suite or even in the VP level, right? And they're still stuck at this manager or director type role. And I want to ask you this question. Is it important to build executive presence and influence? And how do you go about doing that, if it is?
Well, the first thing I'm going to do before I say the I,
Okay.
and Mark, I'm sorry. I'm going to say this, but you need Mark Erath. You need John Gracious. You need people that advocate for you in rooms where you're not. And quite frankly, the qualities of the people that have done that for me are the people that have kind of recognized that, oh, this guy works. Even at General Motors, I told you when we did our one-on-one that the gentleman that Al Westby, the business manager that time, that he really was gruff, but he really liked me because I really work hard at what I try to do. And so when you have people that recognize those things and they say, okay, now I have a person that maybe, down the road, if I let them do certain things, then they will pick up more skills and then they advocate for you. So before I say me, I'm going to thank those people that advocated for me in rooms that I was not in. And that's very important. And I think as leaders, we have to keep doing that. Succession planning and recognizing people that have the special it. What is that it? It doesn't necessarily have to be that you are, Albert Einstein of healthcare administration. But and then, I was listening to Floyd Mayweather the other day. He was at first. He said he was like, "I'm not the sharpest knife in the drawer, but I'm a knife and I'm in the drawer."
There you go. Yep.
I don't really take a lot of quotes from Floyd Mayweather.
Yeah,
that was a good one.
That was a good one.
And I'm in the drawer. And if you give me a chance and sharpen me, I could be the sharpest knife in the drawer. I think that's really part of a leader's job, is to recognize those type of people, and that if you push them a little bit and give them a little bit more, sometimes a stretch job. The reason I got that bad job, that crazy job in trim, I found out later. Al called down there and said, "Put that guy in your worst area." And I was like, so I called him. I was like, "Why are you doing it?" He's like, "You can do it. This is, why would you do that to me?" But he knew that that would help me and that would stretch me. So as leaders, we have to do that. But as individuals, I think what you have to do, and the best advice that I ever got from, I think her name is Pat Gritterville. She was a director at General Motors as well. I went to her because I was ambitious and I wanted to move up. And you hear those titles like director and 7th. Right. I'm on my 8th level. What I got to do? Da, 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 da. She said, first of all, put your career in your own hands. Okay. If you put your career in your own hands, you can't. If you're waiting for someone to come and take you and say, "Come this way," you may get that, but that's few and far between. And when you get to that position, are you really qualified? The thing that I really understood about myself, that the positions that I did not get allowed me the opportunity and the time to reinvest in myself. So things that I did. So if I didn't get a position, I would ask myself, why didn't I get it? Well, you don't really have an understanding of revenue cycle. You don't have really understanding of finance. Maybe you need to look more into the quality things that you said you do, and you need to get more experience on doing projects. So I would go and do those things. Maybe at one point I didn't have my master's. So when I didn't get a position, I went and got my master's. And every time I do that, and when I look at the education that I got, I'm like, oh, I wasn't ready for that. I really wasn't. In my mind, I'm thinking I am, but I really wasn't. I really didn't have the skill set, So, and when you pick up stuff, I got my fellow from ACA, American College of Hospitalization. I didn't know how much I didn't know until I got that fellow. I got my fellow from the Texas Hospital Association. I didn't know that government advocacy was so important in healthcare. But right now, as we sit and all this policy is being changed on a minute-to-minute basis, probably the best thing I've done in the last 5 years is go get that government advocacy fellowship. I would have never have done that had I got the position I was looking for. And I did get a position that caused me to reinvest in myself. So as you are trying to, if you're ambitious and you're really, like you said, most of the time people in healthcare's ambition is fueled by a need to help people, a need to help community, because you simply cannot sit on the sidelines. And it's something in you that use that drive to pick up these skills. There was an astronaut, I can't think of his name, Hispanic. They made a movie about him, A Million Miles Away. And I can't think of his name right now, but I saw him at a lecture. And he wanted to be an astronaut, and they had declined him like 40 times. Like, it was an astronomical amount of times. And after the 20th time, he was talking with his wife, and he was like, I'm getting tired. I'm going to give up. And she said, well, before you give up, what are you missing? And so he went and he became a master scuba diver. He ran a marathon. He became an outdoorsman, like a survival person, and all this stuff. He gained all this skill. He became a pilot. Now you think about those 4 things by themselves. You're like, well, why would an astronaut need to know that? Well, when he finally got accepted, guess where they practice how to survive on Mars? You know where they practice at?
No, where?
The water.
Oh,
that's where you need to be a master diver. You needed to have endurance. If you're going to go on a space shuttle, which is kind of like a plane, you probably need to be a pilot.
Yep.
If you're going to survive in dangerous terrain, you probably need to have a survival. You probably need to be a survivor and know how to survive. So those things that he picked up actually helped him become an astronaut, because once you actually get accepted to the program, then they really start taking you through it. And he got through it, and he actually went up in the space shuttle. And so that those types of things are inspiring. When you hear about somebody that, is trying to move up, the thing that I say is, as you're moving up, keep that same ambition, but reinvest in yourself. What do you need to know for that next level? Talk to a mentor. Look at their resume. What do you need to pick up if you need to go there? Don't just rest on your laurels and thinks that somebody's going to come and, bless you with whatever. Because if they do it, I don't know if you're going to be skilled enough. And you're playing right in the Peters principle. You go to the highest level of your incompetence. We don't need leaders like that.
Right.
What I would say to any young careerist coming up: invest in yourself and take the time, push, but just be sure if you're reaching that point, what do you need to do to reinvest in yourself?
Good.
Love it.
I
That's
love
some
it
good
too.
stuff.
Yeah. Mark, is there or Dr. Trinette, is there anything else y'all want that? Y'all good with that?
I think he hit the nail on the head. Basically, as I tell everybody, and it's because I had to learn this lesson myself. Don't wait for them to come to you and push you to develop yourself. Develop yourself right now. So every no that I got right in the healthcare realm, and it was disheartening to get no's because I felt that I was prepared, and in some respects, for some positions, I may have been.
Sure.
But I learned to turn those, what I considered at one point losses, into lessons. So it's still a L, but it's no longer a loss. It is now
Right.
a lesson. Why wasn't I chosen for that? Is it something that I need on my resume? Do I need to develop myself further in some way or mechanism? Or am I really not ready for the backside of what I consider the blessing, right? It looks good. Everybody wants to be in the spotlight. They want the corner office. All that sounds good, but you will be there a very, very short period of time if you have not developed yourself appropriately and you're moving into that role knowing that you can take on the task at hand. Do those who sit in the chief suite know everything? No, but they've done certain things to develop themselves and to make themselves uh, appropriate for that role in that moment. There are so many working on the front line. I remember interviewing, and we did this religiously at various hospitals where I was in nursing leadership. And I would interview new graduate nurses, and I ask them one simple question: where do you see yourself? What do you want to do? What's your ultimate goal? Close your eyes. Tell me where you want to be when you look back on your career. Where do you want to be? Well, I want to be literally a chief nursing officer in the next 2 years. And I was like, honey, different levels, different devils. As we say in church. The backside of the blessing will take you out. You have to develop yourself. You have to get to a point where it's okay. As John Hope Bryant said, and this is one of my mantras now: I eat no for vitamins. So if you're telling me no, I'm going to use that and say, okay, I'll be ready for them next time. Let me develop in some way, shape, or form so that when it's time for me to stand on that stage, I'm not getting oranges and apples thrown at me, right? So develop. That's a key point. Thank you so much for sharing that. Good pearls.
Thank you, Dr. Pierre, too.
I eat no for vitamins. I've
Yep,
stolen that now.
exactly.
I'm adding that.
Hey,
Right.
Patrick, could I add something?
Absolutely.
When you mentioned incompetence, that was something I could identify with, Heron. And so I wanted to endorse your point about mentoring. That's the big difference maker. And the thing that I wanted to add is I think we've all heard that, one of the secrets of success is to not try to be the smartest person in the room. So leaders, so-called mentors, are looking for proteges who are a lot smarter and capable than they are and bring diverse skills that they just don't possess. And so I would endorse your point that, as a ambitious future leader, you really need to work hard at cultivating and sustaining those mentoring relationships, because people are looking to you to bring added skills and take on responsibilities accountabilities and authority, that gives greater span of control, so the leader can handle things of greater scale and scope. So
good stuff.
Everybody working at the top of the licensure. That's a great point. That's a great point. If everybody, what I tell my staff, even let's say, I don't know if you all, well, I'm not talking to you, you guys know, but the audience, the structure of a primary care office is when you come in, everybody goes to the doctor. The person that checks you in is basically part of my staff. And so that person, to me, is part of the care team. It's them, the business side, it's the nursing side, which is delivery, and it's the provider side, which is the actual the medical care. And it actually kind of fits the triple aim too, but we can go into that. But what I tell those people are, you may come in here and think that all you're doing is scheduling, but out of that care team, you are the business expert. I don't expect the nurse to do it. I don't expect the doctor to do it. If there's a question about insurance, if there's a question about scheduling and consents, you all should know. And that is an entry-level position, but I expect them to be managers of that position. So when I tell them that, I tell my managers to take a step up. I tell the directors to take a step up. And that allows me to be where I need to be and be out pushing forward at the tip of the spear with innovations, and they can come back with barriers, and we work together as a team. But everybody, it is not time to rest on your laurels and just do the minimum. I need you at the top of that, whatever your license is, whatever your education is, or disciplinary, or whatever function you do, you need to be at the top of that. If you're at the front desk, manage that provider schedule. We're looking at productivity. If you see an empty spot there and the patient walks in off the street, put them in there. Discuss with the provider if it's close to lunch. Can we do this? Manage the business. And that puts them in a kind of a forward lean also, because then, even though that's an entry-level position that doesn't require a degree, they start thinking, oh, maybe I can be a manager. So now we're having discussions about your career path. So let's talk about where we can go get you the education. And a lot of those people, I've had many people that work for me start at the front desk and now they're running the clinic, because I believe if you want to stay there, that's fine. And I'm still going to have you work at a very high level. But if you want to matriculate up, I can make a pathway for you as a mentor, because I've been where you're at. And really, I want those type of people. I want those type of people that are the kind of the salt of the earth, that have been at the front desk and done it, and now they want to move to a supervisor position, to a managed position, because they know the business, they know the job. And when you get at higher levels and you have that type of skill, you can really make things happen. And you can also understand when the organization is being stretched beyond its capacity, and maybe when it's not that much. For people who are saying, I'm working hard, but you're like, look, you're not really working. I've done that. And it seems hard to you because there's a lot of waste in it. And another quote that I like from Bruce Lee: speed is the illusion of efficiency. It's not that you're chaotic and moving around fast. It's just that instead of having to walk halfway across the office to the printing machine, it's right there. So now the process is faster because I've just moved it closer to me. Am I going faster? No, but the process is faster. And so I always tell my staff that I'm not asking you to be out of control. What I'm asking you to do is be efficient and repeatable. Repeat the standard that we have agreed to. And that way, errors are more pronounced. Your job is better. You're not getting burnt out, and you're really providing the value that the patient is there to have.
Topic 2, career transforming strategies for leading career growth and change. So here's the question that came in. How do you identify and leverage opportunities for career advancement?
So I think really, again, doing a kind of a self-inventory. Is that where you want to go? Based on where you're at, based on your skill level, based on your drive, is that where you want to go? So for me, let's say for me, when I was a project manager and when I was doing PI, the opportunity came available to, run a clinic in the East region. and I was working with a very kind gentleman named Dr. Ishmael Porsa. Mark, you may know him. He's the CEO of Harris Health right now. And I went to Dr. Porsa and I said, Dr. Porsa, I would like to move into that position or be considered for it. What do I need to do there? But that was kind of the end of a conversation that we had started years before when I told him I was interested, but I didn't have really the acumen to move. And so don't be surprised if something that you want right then, if it's not immediately available, but you should still start having those conversations and making it known. Because if you don't say anything, then nobody will be trying to angle you to get in there. So when you see these opportunities to advance, but even before they come, you need to start letting senior leadership know, this is what I'm interested in. So then as you're working, doing projects with them and something comes open, your want to be in that position and their knowledge of what your desire is and knowing what you've done will put you in a position. Now I'm not saying that they're going to take you and put you in there, but at least you'll have a shot. You'll get the interview, whatever. They'll be looking at you as a serious candidate. So you have to marry what you want to do internally, campaign for yourself, make it known. Don't be silent. Don't sit in silence. And then, like we've been talking about, gain the skills, start talking to the mentors what I need to do so that when that position comes open, you'll be more valuable for that type of position.
So in summary, what I picked up on is finding your voice, sharing your voice, positioning yourself for those opportunities, and then going after those opportunities. I think what a lot of people struggle with, and maybe you can give us some more clarification, is how do you go about finding your voice then? Because I think that's where a lot of people get stuck. Yeah.
That's hard. A lot of people that I deal, some of my colleagues, some of the smartest people that I've ever dealt with, they go through this thing called imposter syndrome. Have you ever? And they come to me like, Heron, I've been, you're the genius. Like you were 10 times smarter than me. What are you talking about? No, I don't think I've. So I think that, you have to step outside yourself. Okay. You have to not be afraid. You have to not be, silent. People need you.
Yeah.
Okay. You have desire to help people and people need you. If your roadblock is you can't communicate, find a way to do that. There's a lot of things out there that help you to talk. But really, it's just taking that first step and just telling someone, this is what I'd like to do. And it's really an introspective look. The things that you say you can't do, that internal battle that you have in your head, you have to think when your brain says, well, I can't do it. Well, why? Why can't I do that? Yeah. Is it a training issue? Is it, do I not have time to do it? Is it really legitimate? Because 90% of the time it is not. Your brain is probably your worst enemy. I'm trying to tell you what not to do. You can do it. And I'm not telling you this because I'm a genius. I'm telling you this because these are the battles that I go through every day.
Yep.
Even still in this current position, working with market, being a professor, I'm worried about if I have the best lesson plan for my students. It's just that's what you do. If you're a thoughtful person, you think about those types of things. So just do the self introspection, find your voice, talk to your mentor about if you're having issues, having those discussions. Your mentor may have some things to tell you that you can work on. Go to things like, I think Toastmasters is an organization that's great for helping people talk in front of crowds of people. But you have to say something. If you want to go into leadership, you're going to have to talk anyway. So you might as well start with campaigning for yourself.
And I think this too, and I share my story too. I think everybody kind of goes through a bit of imposter syndrome. It's just the scale of which you may allow it to impact you, right? So I remember my first leadership position, I felt a little bit of imposter syndrome, but not as much as I did last summer. And last summer is where I actually attended this reality show where there's nothing but entrepreneurs that trying to grow their business, right? And everything is filmed and it's recorded or whatnot. And that was the biggest time that I felt like an imposter. I felt like Man, these people have been hustling, doing their own little thing, but they've been doing it in a different way. I've been on this healthcare journey, and I felt like I was comfortable because I understood more about healthcare. But being an entrepreneur, I didn't really understand that, and so it made me feel uncomfortable in a way. I had to step back, and I was looking around. I was like, man, yeah, they look like me, but they've been doing it maybe longer than me. So it gave me some imposter syndrome. And what helped me out is I like I like reading. I'm more so audiobooks, right? I can't physically have a book in my hand, to each his own, right? But for me it was audiobooks. And one of the books that I listened to, and I love this actor, is Matthew McConaughey. He has his own book called Green Lights, and it's more of like a biography about his story in life, and he talks about his own personal struggles with imposter syndrome as well. And I reflected on that particular book and him telling his story. So here he is, this A-list actor having imposter syndrome. And he talks about how you just kind of, sometimes you got to step back, reflect, you got to process, and then just get back into the game. And so that's some of that is, what I would like to share as well. Sometimes just step back, take some time, think about why you're there. Think about that these people look just like you. They're on the same journey as you as well. And then just get back into the game. But you can't allow the imposter syndrome to prevent you from moving forward. Otherwise, you just won't.
Right.
Patrick,
Go ahead.
Can I say one thing? I think Heron has touched on something really important earlier, and sticking with a healthcare sort of metaphor, the best vaccine against imposter syndrome is self-empowerment. And Heron mentioned in his journey how he went and got additional skills, certificates, training, experiences that prepared him for what was around the curve to be capable of handling new levels and scope and scale of challenges. And to me, that self-empowerment, people see that you're smarter than they are, you can do the job better than they can, they will embrace you and pull you up and help you work them out of a job so they can go on to something greater. And that them seeing how you've bettered yourself, become a better version of yourself, more capable, that puts substance behind the ask for the job, like you said, Heron.
Yeah. Good stuff. So because we've got 10 minutes left in the fireside chat, I want to get to topic 3, which is leading diverse teams, managing conflict, and communicating effectively. So the question is, how do you communicate with authority while fostering collaboration?
That's a great question. Okay, so one of the things that I try to do, so I would like to think, my staff is not on here, but if you ever bump into them, and what they've told me is they really like me. Okay. Now, does that mean that I'm always a fluffy, a happy person? No, not at all. But what I am is I'm consistent and I'm fair. So
preach, sir.
I'm consistent and I'm fair. They know what initiatives we're trying to work on. They know my reaction to whatever. And my reaction can be, they could probably come in and tell you what I'm going to say before I say it. When they have disagreements with themselves, the first thing I always ask is, did you guys talk to each other before you talk to me? A lot of places that I've been to, they kind of will pull in the manager. And it's really important that team members communicate with themselves. There was a situation where I had a team member from a certain organization that was feeling that they kept on saying that this stuff was happening, kept on, this error keeps happening and I'm tired of it. I keep on saying it. And they said, how much longer do I say this? I said, you keep saying it until it's fixed.
Yeah.
You keep saying it until it's fixed. What you are calling having to tell somebody something's wrong, high reliability organizations call that feedback. Okay. What if somebody had have had that dogged attitude that I'm going to keep on bringing up this subject until somebody does something about it? In the space shuttle catastrophe, where the foam had fallen off, and there was one engineer that said, "Hey, this is too much. We can't do this." And they were like, "Oh, it's okay. Some foam fell off," and he was like, "But this time it's a lot."
Yeah.
And I think it's gonna be a problem. And somebody just said, "No, we don't know about." You have to push back on those things. You have to keep on saying those things. Say it till it gets fixed. Say it 100 more times. So you have to make sure that the lines of communication are always open. I've seen a lot of great management structures, matrix type structures, which we would think that matrices are kind of like a higher level of management. You have multiple people acting as peers. I've been involved in that, but that doesn't work if the communication breaks down. If you don't know how to de-escalate certain situations, if you don't have great training in conflict management. So that's got to be the first, that's got to be, and it's got to be intentional. It cannot be where they put all of us together, because I know we all like each other on this fireside chat. I could sit and talk to you all night.
Right.
But we need to be trained on how to communicate. We need to be trained on how to understand that if somebody's coming with us with a disagreement, and maybe they're a little bit agitated, but what is their intention? Because we've already ascertained that all of us on this call want to help people. So you may be a little bit agitated, but what are you saying to me? Get through the layer of emotion and say, okay, maybe this person is bringing something to me that's extremely valuable. What is their intention? If their intention is not to hurt me specifically, their intention is to help the patient population. So let's get together. Let's de-escalate, kind of cool it down a little bit, but let's talk about that. Let's talk about the root cause, but let's keep talking. That is the most, out of all my 25 years I've been in organizations. If we are not communicating with each other, then you can't do anything. The other part is, they say no margin, no mission. You've heard of that?
Yep.
Well, you can't process and prove yourself out of a bad culture. So you can say Lean Six Sigma as much as you want, but if your culture is bad, you're not moving anywhere. So you have to spend, time and treasure on that, making sure that there's a culture of openness and honesty and trust and individual respect and responsibility. And if you start there, and if you pump gas into that, then you can start to do all the other magnificent things, and your communication is better because you have that as a framework. And that's another reason why I like Lean, because in the Japanese culture, that's one of the things that they honor. It's very honorable. I saw another thing at the conference. When you wake up in the morning and it's 6 o'clock and you say, I have to go to work, the gentleman that was giving the lecture say, I want you to change one word in there. Change have to get to. Change have to get to. I get to go to work today. Yeah. I get to interact with the people in Fair Park today. I get to save one more person that maybe down the road was going to, not be with us because of their diet. Maybe they're uncontrolled diabetic. That maybe I've saved a limb. Maybe I've saved a single parent from going blind from diabetic neuropathy because of the services I provide, through the clinic. And when you talk about that type of thing, you turn it from I've got to go do it, or I have to go do it, to I get to do it. I have the privilege to go do these things. That changes your mindset. So I think those are the three things that I would say off the top of my head. Communication, culture, and your perspective on your reality. We get to do this. It's hard. It's very difficult, but we get to do it. This is what our passion is. So we should be happy about that.
Heron, we're also going to be pushing up against the clock, and I want to wrap this up. But there's one more.
I took a lot, but I really have. Culture is something that you have.
No, you're passionate about it, and I respect that. So the last question that I have, and if we can do this one quickly, so I can make sure you can do your closing, who you are. That'd be great. The question is, what are the best certifications for healthcare leaders?
Who the best certifications?
Yeah.
Well, as an administrator, I'm going to go ahead and say the fellow of ACHE. That was magnificent. Fatchy. Mark has one. He's been a long member in that. Trinette has one. She's been along. She actually helped me get involved in it, helped me through my certification. But that was a good one. Anything related to political advocacy. Of course, higher education, your master's will let you understand. Once you start doing your master's in business administration, then you're talking about the theory. And, when we're talking, and that's one of the classes that I teach, and Mark brought me into that. When you start thinking about theory, it's not just any one theory is right, but it gives you kind of a way to create how you want to act as an administrator and where you want to be at. And it's situational, but you tend to bring in the appropriate strategy when you have the right tools. If you don't understand, if you don't have any tools, how do you know what to use? What's the other thing they say, Pat? If you're only a hammer, everything looks like a nail.
Right.
So you have to bring in different things. And that only way to do that is get higher education, more certification. And then if I have to, the coup de grace is some type of performance improvement certification, whether it be Lean or Six Sigma or Lean and Six Sigma, green, black belt. Go get yourself some of that, because that's all we do all day, 7 days a week is problem solve. So if you have those things in your belt, you're probably going to be a pretty good manager.
Love it. I love it. I love it. I love it. Listen, I know you didn't ask for this here, but I'm going to have you close this out here in a minute. But in closing remarks here, I definitely want to thank everybody for joining. For more insights on leadership coaching, you definitely want to connect with Heron Mitchell. Even though he's not a coach, he's a chief leader within the healthcare space. He's kind of been there, done that. And you can tell from this fireside chat, he's got tons of insight and knowledge that you can glean from him. And then also, opportunities wise, we're talking about mentorship, we're talking about career development, we're talking about maybe your next organization that you're looking to work for. This will probably be a dope individual you want to connect with. So I'll put his information right here, his LinkedIn handle. Of course, myself as well, PDP Media. You definitely want to connect with me, follow along as I introduce you to other leaders, much like Heron and Mark and Dr. Trinette that's on this call as well. People that's kind of been there, done that can help you navigate your career path as well. So with all that being said, Heron, please close us out with any parting words for the audience, man.
All right, very quickly, change your paradigm, because a shift in paradigm changes your perception. Invest in yourself, believe in yourself, get with around like-minded people, and always push for what drives you. And what drives us in this space with that healthcare guy, Pat, is in this space with us, is we want to help people. And we can do it if we all work together, but it's going to take all of us, and it's going to take diverse thought to get through this. So just don't stop, keep pushing.
Thank you for that. Thank you for your time. We appreciate the insight.
Take care, guys.